This community update was brought to you by WHRA. As Manitobans brace for winter, it's also time to prepare for flu season, which runs from November to April and brings both influenza and COVID-19. Though infection rates are still low, regional health authorities urge residents to get vaccinated before cases peak. Dr. Bumi Fatoye, Medical Officer of Health for the Winnipeg Regional Health Authority, explains that respiratory viruses like influenza and COVID-19 spread easily through droplets from coughing or sneezing and from contaminated surfaces.
And when people get ill, most people will recover, but some people would have more severe disease that might lead to complications. And so we want to prevent those severe complications, those severe illnesses. And we don't know who can get it. We know certain risk groups that are more predisposed, but we want to prevent it. And that's where the vaccine comes into play.
The best time to get vaccinated is as soon as vaccines become available, often in October. But it's never too late. Vaccines take about 2 weeks to provide full immunity, so acting now ensures protection as the season intensifies.
First and foremost, we're still learning more about the COVID strain, so I don't think we have enough time to really predict a pattern for now. So we're going to wait and see how the season evolves with the COVID-19. With the influenza strain, locally, it's still very early in the season. We're still watching to see how the strain is going to manifest in the population, whether it's going to be a typical influenza season or not. But if we go by other jurisdictions like Australia, where they have completed the flu season, we can expect a normal influenza season.
Vaccines are free and accessible at pharmacies, primary care providers, public health offices, and pop-up clinics. For families, influenza and COVID-19 vaccines are available for anyone aged 6 months and older. Individuals without ID or a health card, including those in precarious situations, can access vaccines through public health offices. Online tools and multilingual resources make it easy to find vaccination sites and book appointments.
The vaccine is safe, it works, it prevents severe infection, and there are 2 separate vaccines, one for influenza and one for the COVID-19 infection.
Dr. Fatoye advises practicing good hygiene to curb virus spread. Wash hands frequently, stay home when sick, and wear masks in crowded spaces if symptomatic. You're listening to WHRA, where community voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.